Hi, my name is Jen. I'm a nurse here at SDBotox. Today we're going to be playing with our LaseMD Ultra. It's a great 1927 wavelength laser that addresses fine lines, pores, texture. It's fantastic for melasma and all skin types. So let's get started. You shouldn't really have any discomfort or pain. If you do, let me know. So what we're doing right now is putting tiny little microchannels into the skin. This is a non-ablative laser, so the downtime is really low. Most of the time, after about 24 hours, clients will have just a little bit of a texture on their skin that most people cannot see, but you'll feel a little bit of a sandpaper on there. It goes away within about 10 days, and then your skin glows. The little microchannels help to build collagen and elastin deeper in the dermis. We use this laser a lot even during the summertime in San Diego when you can't use a lot of other devices. It's also great for when you have an event coming up and you just want your skin to really shine and have that makeup sit on your face without any crepiness or texture. It's fantastic for melasma, yes. Based off of the wavelength, it's shallow enough to kind of help address that pigment without creating any additional repercussions like other lasers can have. Usually we do recommend a series with the LaseMD. Depending on your concerns, we'll be doing anywhere from 3 to 5 sessions spaced about a month apart. The skin will feel pretty hot for about 30 minutes after the procedure. After that, it'll die down and you'll just be left with a little bit of redness on the skin for a couple hours. So just gentle cleansers and lots of hydration. Lutronic has a hair serum that you can do hair restoration with it as well, because you're able to put those tiny microchannels into the skin, and then as those microchannels are open, you're placing in a growth factor product to help stimulate hair growth. This can be combined with PRP, stem cells, any of those other types of procedures, again, because we're placing tiny little microchannels into the skin, allowing us to just put great products into it. So good for PRP. So anytime you add PRP to the skin after a laser treatment, it's going to help reduce that inflammatory process and the skin will heal significantly faster. You're going to have a mild texture on your skin for about 10 days. And then I like to give about a week after that for it to kind of come off and really have the skin glow. Very similar to the clear and brilliant. It's a little different wavelength, but it's actually stronger. It has more watt power behind it, so it's significantly stronger than the clear and brilliant. And we actually get significantly better results. So the great thing with the LaseMD is that as I'm kind of going over the skin, I can start to see multiple channels being placed in the skin. The LaseMD can be adjusted to multiple depths. We can go very superficial for things like melasma, and then we can also go quite deep for a deeper resurfacing if you have heavier lines, wrinkles, pores, or even some acne scars. We have the ability to adjust the settings pretty significantly to address different skin types. And it's great for, like I say, all different types of patients of different ethnicities and skin concerns. If you don't have a lot of downtime, this is a great laser for you. We use the LaseMD for melasma because it is a little bit more superficial when it's treating the skin. Its target is going to be water as a 1927 wavelength. So we're not too concerned about creating that PIH in the skin, which creates that inflammatory process. Usually our patients will come in and they'll get the treatment done once a month, probably about 4 to 5 sessions, depending on how severe the melasma is. We will pair the treatment with some quality skincare products to make sure that they're maintaining their results at home. We get a very strong clearance of melasma to help maintain it. Now remember, melasma is something that doesn't go away. It's something that we have to maintain. So seeing that this machine doesn't have a lot of downtime, you can get great results with melasma without always having to be out for 2 weeks at a time. Melasma is very hard to treat. It's not something that you can take away. It's something that you can just make better and make more livable. So when we're using the LaseMD, it's something to just help to lighten up that pigment. So that way when you place your makeup on or you don't put your makeup on anymore, it's not gonna be so obvious that you have splotchy pigment spots. Great for those fine lines over the lips. Nobody likes those lips, whether you're a smoker or not. They tend to appear. This is really good for that area as well.